Hello, my name is Dr. Diwan S. Raja. Today I will discuss about sickle cell disease. Sickle cell disease is a hereditary disorder and there is abnormal production of the hemoglobin as well as the abnormal shape of the RBC. So, the sickle cell anemia is a hereditary disorder. Okay, it is a disease of the hemoglobin. So hemoglobinopathy, and there will be production of structurally abnormal hemoglobin, and there is production of structurally abnormal hemoglobin, and the production of sickle shaped RBC or red blood cell or erythrocyte. Okay, so this is the hereditary disorder. So in our adult we have three types of hemoglobin. In an adult we have three types of hemoglobin. Okay, so one is hemoglobin A, another one is hemoglobin A2, another type is hemoglobin F. Okay, we have three types of hemoglobin, and hemoglobin A is around 97% or 97%, maybe 96 or 97%, 96%, and hemoglobin A2 is 3%, and hemoglobin F is 1% in an adult. Okay. So what happened in sickle cell anemia? There is a point mutation. Of the beta globin gene, So the glutamic acid is replaced by valine. Okay, glutamic acid is replaced by valine. Okay, so glutamic acid is replaced by valine. We'll get the hemoglobin S. Okay, so we got the pathogenesis and the genetics of the sickle cell anemia. This is a point mutation, and glutamic acid is replaced by the valine. It is present in around 8% of the African American as heterozygous. So 8% African American are heterozygous. Okay, that means around 40% of their RBC are sickle cell. Okay, so other 60% are normal cell, but it is present in Africa. 30% of African population, African black population are heterozygous. Okay, you got that? So what is the pathogenesis? If we go there, so this is our hemoglobin S, this is the RBC. RBC is, if you see from the side, RBC should be like that. Okay, should be like this, RBC. Okay, so this is the RBC. So what happened? Due to deoxygenation, RBC will be sickled. Okay, due to deoxygenation, RBC, or we can say erythrocytes. Okay, the RBC become sickle shaped. Why sickle shaped? Due to deoxygenation, what happened? There will be polymerization of the hemoglobin. Hemoglobin are no more free floating liquid. It will be a viscous gel, and there will be distortion of the RBC. Okay, due to dehydration, the hemoglobin becomes gel, viscous gel. Okay, it polymerizes. Okay, it is thickened, it is dehydrated, and takes the sickle shape, or we can say holy leaf shape. Okay, or we can say crescent shape, like a crescent or holy leaf shape, or sickle shape. Okay, this happened due to deoxygenation, and there are some predisposing factors for deoxygenation. It may be dehydration, high altitude, due to acidosis, some type of infection that may lead to sickling of the RBC. Okay, so it is reversible initially. It is reversible. Okay, what happened in sickling? What is the way? What are the changes in sickling? What happened? Calcium get in, like the calcium get in. Potassium and water get out of the RBC. Okay, like that. That causes polymerization, thickening, dehydration, and the RBC, not like this round shape, it becomes like a crescent shape. Okay, so remember, calcium may get in, potassium getting out, water getting out. So this is the deoxygenation. This will be the sickle shaped cell. But again, if you give oxygen, then it will be again disc. Our normal shape of the RBC is like a disc. We have thin center, outside periphery is thicker. Okay, that is our normal RBC. So after oxygenation, there will be again normal shaped cell. But if it is continued cycle this way, then cell membrane will be changed. Okay, cell membrane will be changed, cell membrane will be sticky, and there will be, when it passes through the spleen, where very high transit time through the splenic sinusoids, what will happen? Then it may not take this shape. It will permanently convert it into sickle shaped. Okay, this is one way. Another way, the RBC due to deoxygenation becomes sickle shaped due to extensive membrane damage. There may be irreversible sickle cell. Okay, we got that. Both of them has tendency to adhere to the endothelium. Okay, so sickle cell, what are the problem in the sickle cell? Okay, are non-flexible. They are rigid. Okay, rigid. Okay, they cannot shape they cannot change their shape, cannot be deformed, because we have calcium inside, it is dehydration, it is thickened, so that may it cause non-flexible, rigid, and sticky to the endothelium. Okay, and it is prone to hemolysis. Okay, and hemolyze easily. So normal RBC, the lifespan is 120 days. Here lifespan is only 20 days, 160 lifespan. Okay, so lifespan of sickle RBC is around 20 days, and when it goes to the spleen, it is easily taken by the mononuclear phagocytic cell. There will be hemolysis. Okay, as because there is more hemolysis, there will be anemia. Okay, so there will be hemolysis, anemia, vaso-occlusion. Okay, so we have many problems with that of sickle cell anemia. So this is the pathogenesis. Okay, we have hemoglobin S. We have other type of mutation like hemoglobin C, hemoglobin D. Hemoglobin C even worse than sickle cell anemia, that is also present in African American population to a lesser extent. Okay, so we got the pathogenesis. Now what are the clinical features and complications Okay, so we'll get anemia because of hemolysis. Due to anemia, there will be compensatory hyperplasia of the bone marrow. So bone marrow hyperplasia initially, to compensate anemia. Okay, that may expand the marrow space. So expand the marrow space. Okay, so if you take X-ray of the skull, we'll get crew-cut skull appearance. Crew-cut skull in X-ray. Okay, because of bone formation, bone growth, there will be spicules of bone in the skull in the X-ray. Okay, due to anemia, the person will be weak, fatigue very quickly because of anemia. Because of hemolysis, there will be hyperbilirubinemia. Okay, hemolysis will lead to jaundice because of excessive bilirubin, yellow coloration. Okay, we got that. That is the problem. So, if you continue that, all organs are affected. The lungs will be affected. So, there will be pneumonia. Okay. Even there will be chance of cor pulmonale. Okay. So, all organs are affected. Bone may go through infraction that may mimic that of the osteomyelitis, may look like osteomyelitis. So bone has also pain. In case of children, there will be pain in the joints at the periphery. Okay, so that is a problem in case of involvement of the bone and joints. So if you go to the kidney will be affected. Okay, it may also go through infraction. Kidney may go through infraction. Liver function will be altered. So liver function altered. Liver function will be altered. Retina, changes in the retina. Retinal changes. Spleen. Initially, spleen, they may go to splenomegaly. Due to sequestration of the blood there may be even hypovolemia. Eventually, there will be autosplenectomy. So spleen will disappear. We'll get only a few fibrous band of tissue in the spleen, especially after puberty. No spleen may be palpable. Spleen may be squeezed to some fibrous tissue. So as because there is no spleen, there is more chance to get encapsulated organism like that of Haemophilus influenza, pneumococci. Is because no spleen, more infection. Because there is no filtration by the spleen, so there will be encapsulated organism like that of pneumococci and Haemophilus influenza, because this will cause infection, and there will be lack of complement system, lack of opsonization, so there is more chance of infection. Okay, so more chance of infection. So all organs are affected. Then there may be cerebrovascular accident in the young age, or stroke. Cerebrovascular accident. Okay, that is stroke in the young age because of vasoocclusion. Occlusion. Okay. Vaso-occlusion also cause skin ulcer, non-healing skin ulcer, non-healing skin ulcer, especially around the lateral or medial malleolus skin ulcer. That is a possibility. Okay. We have vaso-occlusive pain crisis. Okay. So vaso-occlusion, and there will be pain crisis. Okay, due to vaso-occlusion, ischemia, there may be pain in the abdomen, pain in the bone, and also there may be persistent erection of penis. We call it priapism. That is persistent erection of penis. Okay, so we got that. And if the child is homozygous, usually they die very early. So how we manage a patient of sickle cell anemia to avoid the predisposing factor that cause sickling, vaso-occlusive crisis, and also the pain crisis, like dehydration, acidosis, high altitude staying in the high altitude, okay, in low oxygen. So that may cause the vaso-occlusive disorder. It should be avoided. Okay. So management by hydration, oxygen, blood transfusion. Blood transfusion should be judicious. Too much blood transfusion may lead to iron toxicity. So blood transfusion. We got oxygen, hydration, blood transfusion, and the prophylactic antibiotic like penicillin, like phenoxymethylpenicillin. Okay, and the good hope is that, very good hope, with a medication called hydroxyurea. Okay, how hydroxyurea work? Hydroxyurea increases the level of hemoglobin F, or fetal hemoglobin. Usually in our adult it is only 1%. So if we can increase the number of fetal hemoglobin, then the stickiness of the sickle cell will be decreased, and sickling will be prevented, and inflammation will be decreased. Okay, so hydroxyurea, it increases the population of hemoglobin F. It prevents inflammation. Okay, so it prevents adhesion of the sickle cell to the endothelium. So it has many benefits, but it may cause leukopenia. So it may be an adverse effect of hydroxyurea. Okay, so that's all about the sickle cell anemia. If you have any question, please feel free to ask me. Please support my channel, subscribe me, and share the information with your friends. Have a nice day. Bye now.